Thank you very much. What I'm going to talk about this afternoon is distance learning in neurology with a focus on international video conferencing in behavioral neurology. First, in terms of disclosures, although I am a trustee of the World Federation of Neurology, and that's the WFN, and I will be referring to the WFN in my presentation, please note that I'll be speaking as an individual and not as an officer of the World Federation of Neurology. In terms of the objectives, threefold. What I'd like to do is first discuss the difference between video conferencing and webcasting, which is an important distinction that not everyone is aware of. I'm also going to talk about our international behavioral neurology rounds that we've been doing and challenges for future directions. And before I start, I'm just curious, in our audience, how many people, by show of hands, have participated in a video conference round educational session? Just raise your hand. Okay, lots of people. How many have done this at an international level? Raise your hands. Okay, a few, a lot fewer. The focus of this is the use of this technology for international sharing of information. So let me first start with a definition. What is distance learning? Distance learning, it's an educational process, and it's where the educators and the learners are at different places, and they can be anywhere in the world. So this is global. So let me ask you a question. We have a small number of people, so we could actually have some interaction here. What are the classrooms of the future going to look like? Any ideas? Is it going to look like this lecture hall? Yes or no? Raise your hands if you think it's going to look anything like this place. Who thinks it's going to look very different? It's going to look very different. It's going to look like this in a museum of education, because people are not going to be going to lecture halls. They're going to be doing their education with distance learning wherever they are. So this is the Museum of the Future. And it's not too far off. Okay, so in terms of video conferencing, there's actually a special definition of this. What video conferencing is, it's where two or more sites communicate, but they do it in real time, two-way video and audio. Now, it's private in the sense that you can't join this unless you sign in. And examples are the television quality equipment that we use, and I'm going to show you, Skype, and Google Hangouts. Those are where you have to sign in. Webcasting is different. There is real-time recorded in video broadcast over the internet, but the two-way interaction is quite limited. And what you should know for healthcare is it's not private. You have no idea who's listening or who's watching. And you can later on, usually it's later on, get the IP address, but that's often in hindsight. So it isn't private. And if you're showing patients, you got a problem because you can't do that. All right, so let me shift now to our international rounds. And I'm going to show you videos of our interactivity and how it actually works, because I really think this is the future. So back in 2005, we started this, and we had international behavioral neurology rounds, and we've been doing them every month, and I'll give you more details about them in a moment. And then in 2008, and I'm going to, again, show you videos and give you more details, there was a neurology resident-initiated round, and these are all, and everyone's going to be invited to join these in future if you like. And in 2014, we developed an Africa-Canada behavioral neurology round. So going to the first one, the way this all started in 2005, it was part of actually a larger initiative through the Canada International Scientific Exchange Program and the Peter A. Silverman Global eHealth Program. And Baycrest, where I work, was the coordinating site. Now, the initial goal of this was actually not simply education. It was actually using healthcare as a language of peace. And what we wanted to do was, there was a focus on the Middle East, and we wanted to build bridges through healthcare with colleagues in Canada, in Israel, in Jordan, and in the West Bank. So that's how it all started. It was sort of healthcare as a language of peace. Now, what's important when you do this, to make it successful, it should never be, and I can tell you, going forward, any of you are going to do this, it should never be, we are putting on an educational session for others. For this to be successful, everybody has to be an equal partner and has to be made to feel like an equal partner as well as be an equal partner. And I'll give you some tips on how to do that. So, and the countries that have participated since 2005 include several of them: Albania, Canada, Cuba, Egypt, India, Israel, Jordan, Russia, Saudi Arabia, South Africa, Spain, the US, and also the World Health Organization. And we've been doing this monthly. And our rounds are very multidisciplinary. They're not just neurological, and you can see the whole group of multiple disciplines that are involved in this: neurologists, geriatricians, and other healthcare specialists. So here, you don't see it very well, but I just want to show you this. One of these is the pointer. This here is Jordan. You're going to see a lot of this better in the videos, but I just want to show you. This is Jordan. This is Israel, Yakir Kaufman, who was one of my former fellows. This actually is the World Health Organization, and this was back in 2005, and I can't remember who that is. This is Arnie Noyak, and he's the one who actually spearheaded all of this. He's the founder of CISPO. And this, for those of you who know, is Gustavo Roman, who came and did a round. Gustavo Roman is the Roman criteria for vascular dementia. So what we do is we do case presentations, we have lectures, and we also have videos. And I'm going to be showing you this. I'm going to show you some excerpts from a case presentation. I'd like to welcome everyone to the next in our series of international video teleconference rounds. Today's round is hosted by Baycrest, although presented by University Health Network. The rounds are coordinated by the Division of Neurology, University of Toronto, and are under the auspices of the Peter A. Silverman Global eHealth Program and the Canada International Scientific Exchange Program, and are sponsored by the University of Toronto. I'd like to welcome all of our international sites and our Canadian sites.
Good morning, everyone, and thank you for joining us. My name is Suvendra Meena. I'm a neurology resident at the University of Toronto at the UHN, and I'm presenting a case of a patient who is sweet and spastic. She had no insight into her cognitive difficulties at this time as well. So you can see also her cube and her clock drawing is tremendously impaired.
Hi, this is Murray. I was struck by the ritualistic and obsessive behavior that the case demonstrated at the beginning, and that the association between this kind of behavior and the right temporal atrophy that you saw on the MRI scan. Could you comment on that?
I don't know of any plans there are. I don't know if Morris knows or anyone else knows in the audience about plans. I know from the Mayo group, I know Keith Josephs quite well. We're going to pool our patients together so we can get more autopsy data from all of this and see, do we see anything else? But I don't know if anyone else can do that or not.
I just want to make a comment. This was a nicely worked up case with the imaging and the behavior. Just wanted to compliment you.
On that note, if there are no other questions or comments, I would like to thank Dr. Meena and Dr. CONy for a wonderful So what I want to show you is what we're doing is we're actually bringing people together. It's all like one classroom. And as I said, this is the way the future is going to be. It's not going to be like an auditorium like this. And so people are going to have to learn how to be interactive, how to involve people, and how to do it in a way that everyone feels like an equal partner. And I'm going to show you, as I said, some tips about this. But this is just an example of the kind of interactive, and you can see how it flows. And the other thing that's important when you do this is accreditation. Our rounds are accredited through the Royal College of Physicians and Surgeons of Canada, which means that anybody in any country, if they allow credits from our society, the Royal College, can call these accredited rounds. So that also is an important point. So the next thing, this is the third set of rounds, but this is a very important one. This is the Africa-Canada International Video Conference Round, spearheaded by Professor Riyad Guidé in Tunisia and myself and Tim Patterson in Canada. This was actually funded by a grant from the World Federation of Neurology. And I can tell you, they just had their first African conference of the African Neurological Society, and we presented rounds in Toronto, Canada, to the group. It was international, but there was actually a session in Africa of our weekly rounds with great participation. So here I'm going to show you another video. That's me on the left and Professor Guidé, and these are his colleagues that you see in Tunisia, and you'll hear Professor Guidé making some comments on this.
I'd like to welcome everyone.
I say this every time. I'd like to welcome.
Series of Africa-Canada International Behavioral Neurology Round. I'd also like to welcome Professor Natalia Shulashova from St. Petersburg, Russia, who is joining us today as well. I'd like to introduce our guest speaker, Professor Riyad Guidé. Dr. Guidé has been instrumental in the development and success of these international rounds involving Canada and Africa.
Thank you, Maurice. Thank you for these warm words. It's also for me a pleasure to speak and to give this talk in these rounds. These rounds were something that we thought about 2 years ago, and they are becoming now a reality.
Okay, so that's the Africa-Canada. Now, this is a very interesting initiative. It's called NERV. And again, all these rounds that I'm talking about, anybody from any country in this audience is welcome and invited to participate. All you have to do is see me afterwards. But this round is different. It's the same that you're invited, but it's different from the other rounds in that this is rounds put on by residents, for residents, internationally, and they don't want the staff involved. They actually want to do this by themselves. And here you see a photo of one round with Natal, Brazil, Sao Paulo, Brazil, Grenoble, France, Ufa in Russia, and St. Petersburg. I just want to show you these residents, neurology residents, how interactive they are. And as I say, they don't want the staff. It's all done by them.
I think we can ask Russia if they can tell us a little bit about how they would manage the patient at their site and what would happen.
For this patient, I would also suggest the outpatient department diagnostic.
Our colleagues from St. Petersburg said a lot about treatment of dementia, and here in Ufa, the management and treatment of dementia is the same. These patients are outpatients.
Thank you for joining us.
Okay, so that was just a clip, but again, these residents do this all on their own, and they do it every single month. All right, so that's sort of what we have. The question is, how do you do it to make it successful? And let me ask you a question. You know, everybody talks about interactivity as opposed to just a straight lecture, okay? And they talk about how it really makes a difference. I'm curious, how many people in this audience, just raise your hand, really believe that interactivity makes a difference to what you're going to retain? If you believe that interactivity makes a difference, raise your arm. Okay, almost everybody. If you don't, raise your arm. Well, it does. It makes a huge difference. And I can tell you, you know, you're all listening to my lecture. You're not going to remember a year from now much of what I said. What you are going to remember is this interactive part, that I asked you a question, and that I asked you what the auditorium of the future is going to look like. You're going to remember that, okay? You're going to forget a lot of the other stuff. So interactivity is important. The problem is that there isn't a lot of information on how to be interactive with distance learning. And I don't think people do it well. The first thing that I want to talk about in terms of interactivity is the chair. The role of the chair is extremely important. And I've seen chairs that have just killed it. I mean, it doesn't do anything for learning, because the chair has to bring in everybody and make them feel as if they're in one virtual classroom. So one of the things that I think, like we have like 30 sites, and you know when people go to the question period, they say, is there a question from this hospital? Is there a question from this hospital? That'll never work on a huge international scale. What we actually do is we say, are there any questions or comments from our partners? And it's amazing. It all works out, because people find a silent gap and they just join in. But you have to leave enough time for questions for this to work. So I'm particularly not a fan of this going from site to site, because you end up embarrassing people. Because in some places, there's one person, and that one person may not be an expert in the area and may not have a question. And when you say, do you have a question? They say, well, no, I don't really have any questions. They feel they should have a question, and you're putting them on the spot. So I would go away from going from site to site. And as I said, you got to consider, you got to make, you shouldn't focus, like right now I'm focusing on people here, but when you do this through video conferencing, you should be looking at the camera, and everybody is part of it, and you don't give preference to the people in front of you. I've seen these things where, you know, it's 4 questions to the live site to 1 question for the remote sites. It doesn't work, and it makes people feel they're not a part of it. It makes them feel like they're second-class participants. And as I said, there isn't any literature, or there's very little literature on the kinds of techniques to use. Now, I'm going to give you some examples of things you can do. And these are safe examples. There are safe and there are risky. Some people like to take risks when they do education, and some people are afraid to take risks, okay? For those who want to play it safe, things that you can do when you do these sessions, live patient interviews, and you ask the audience to interview the patient. I mean, you can start, but you let the audience ask questions, and you let them ask questions from all over the world. Another technique is pre-conference surveys. So what you do is before the round, you send out, let's say your round is on frontotemporal dementia. So you may ask questions like, how many patients with frontotemporal dementia do you see? Do you have these kinds of investigations for frontotemporal dementia? And remember, not everybody is from countries that have the same level of development in medicine. So, and then what you do is you can't go from site to site and ask these questions. It'll take the whole round. But the presenter or the chair can give a summary of the answers to these questions. The other is to ask questions of the audience, but you ask a question that's going to get a response. Yeah, and again, people are not keen to start talking. So you ask questions like, you know, how many people, think about this, how many people would do the following. You could say, does anybody have any comments on the use of drug X in this condition? So it will get you a response. The question is not a complicated one, and it's a good icebreaker. And then there's the open question period, which is the traditional thing. In terms of more risky, see, in face-to-face interaction, there's the kind of thing that I've been doing where you've been asking questions, but also at a sort of a different level, there are techniques. Like one of them is called think, pair, share, just as an example. And you might say to the person, I want you to turn to your neighbor and talk for 30 seconds about a question. Would you ever switch a cholinesterase inhibitor for dementia from one to the other? And you give them 30 seconds, and then you sort of go on to your presentation or engage in a discussion. That's tricky because you can't see the people. You almost need a facilitator in each site to do that. So you do that and you end up with dead air for a couple of minutes, and that's where I mean the risk. But we have to develop techniques for interactivity, because as I said, this is going to be the educational way of the future, not what we're doing here. Conferences are going to look totally different. All right, other challenges. Language is a huge challenge. I mean, ours are done in English, and that's the language of our rounds, but that is a problem for some sites. Time zones is a huge one. We do ours at 8 o'clock in the morning, and you can go to countries where it's later in the day, but not earlier in the day. Now, we have, with India, which is 12 hours removed, they actually have come together in the evening to join our rounds. So in organizing this, the time zones are a bit of a problem. Interactivity, I mentioned, that's a huge challenge. And evaluation. I mean, just like we evaluate regular sessions, we need to evaluate these kinds of rounds. And the evaluations have to take into consideration the different cultures. So just winding up, because I want to leave some time for questions for this group, in terms of future rounds, we're focused on behavioral neurology, but the idea is to switch to other areas, to expand, not switch, to other areas of neurology. Now, what we're working on now is posting these international rounds and the Africa-Canada rounds. They're two series. One's a broader, a general international round. The other's Africa-Canada, where international sites are invited to. We're going to post them on the website of our hospital, and the idea is to get a link from the World Federation of Neurology to our hospital. There are legal issues when you post things on a website. Like what I didn't realize, that when you video somebody, when you video a round, if there's a question and the camera went on the audience, and the audience didn't know that it was being videoed and didn't know that it was going to be on a website, it's on a website forever. You have to tell the audience that it's going to be posted and give people an opportunity to walk out if they so choose. So there's all kinds of things that we're going through now to make sure that we can do this. And evaluation and innovation, we're working on that. And very important, we're working on obtaining resources to assist developing countries to participate. Because I think that this is a great source of information and sharing of information with developing countries. In developing countries, it's a two-way street. Developing countries have a lot to teach the developed countries. So it is a two-way education. But a lot of the developing countries don't have the money. So they're lacking in that. And so you need resources to do this properly. All right, so to conclude, what I've talked about is video conferencing as an educational medium. This is an effective tool for collaborative learning across the world. And it's for continuing professional development and also for postgraduate education. And I think it's good for undergraduate education as well. It's good for all kinds of education. But we have a lot of challenges, and challenges with respect to language, time zones, interactivity, evaluation, and getting the legal issues sorted out. So on that note, I would like to stop and thank you. And if there's time for questions, I'd be happy to answer. And let me just say, if anyone wants to participate in these rounds, come and see me, and we'll set it up. All you have to do, you have to have the equipment. But if you got the equipment, you can join our next round. Thank you.
Thank you very much, Professor Freedman. Stay on the stage, please. We've been listening to the illustration of the successful impact of distance learning in neurology at the global level. And now we are able to discuss on the role of video conferencing. Are any questions, please? please. There is a question.
I can't hear.
How much credit points to dedicate to this issue? Thank you. Sorry. Thank you for very, spread presentation, very perspective one, but how much credit points Royal College of Canada physicians and surgeons dedicate to these rounds? First question. And another question concerning the tools of measure of quality of this education. Tools, theoretical. Right. Thank you.
Both very important questions. In terms of the number of credits, it's 1 credit per hour under our maintenance of certification program. The evaluation and the measure of quality is a critical question. And that's something that, we've had evaluation forms, we've looked at them, but we need to take this to a higher level. And I don't have a good answer for the future of this. What we've done for evaluation is we have standard evaluation forms. What did you learn? You rate the speakers and all of this. But I think we need to look at the evaluation in different cultures is different, and what people need is different. And I think that this is in development stage.
Please, Professor Korchin.
Thank you very much for everything that you are doing. I think it's very important, and I'm sure that it will help a lot. You have started with cognitive impairment, which is, of course, your field, so I'm not surprised. But I think that other areas, and you've mentioned this, but I think it should be stressed, that other areas are also needing the same thing. And not all at the same time, and not all at the same degree of importance. I think in movement disorders, if you can show the patients, show the movement disorders, this will be extremely important. Same with epilepsy, perhaps, where you can show not only the seizure, but also the EEG and maybe the other imaging, the neuroanatomical imaging. I think these are important, and this can be even more fruitful than the cognitive ones, without distracting from the importance of what you've done so far. So what are the plans to expand beyond cognitive impairment?
That's a very important point, and you're absolutely right. I mean, we've started with cognitive neurology, but we really need to broaden it. And there actually needs to be an international curriculum that looks at this, with movement disorders, with epilepsy, with pain. There really needs to be a broader scope in this. We are thinking about this, and that is actually the next stage that we should be going in. And I've had some preliminary discussions in trying to do this. But yes, for sure. I mean, the value of what we're doing here isn't just the behavioral neurology. What it is we've actually learned how to do, we're learning how to do this. We're learning how to make this effective. We're learning how to work with our international partners. We're beginning to learn about interactivity. We need to get on to evaluation. So this would provide a very nice model for expansion. So I agree with you.
Hi, Dr. Freeman. Can I ask a question?
Yeah.
For the Congress like this, we have support, we have the exhibition, company, give a show. But for this video, how you can get the support, you don't have the exhibition. Also, how you control the number of people expand registration, this is the management, Also, as you mentioned, the time zone is very difficult for 14-hour difference or even 7-hour difference. How how you, deal with this difficulty. Thank you.
Yeah, and thank you for your questions. Very important questions. The funding, the Africa-Canada round had some funding from the World Federation of Neurology and had some funding from the Peter A. Silverman Global eHealth Program. The other rounds, we basically do them with the hospital funding that we've got, as we have the equipment in our center. The Peter A. Silverman Global eHealth Program, there are some funds from there. So we're using funds that we have. And as I say, the Africa-Canada did have some funds from the World Federation. The resident rounds, again, they tap into the funds through the Peter A. Silverman Global eHealth Program. In terms of the numbers, I'm not sure if I got your question right. We don't worry about the numbers. We want as many sites as possible. With this technology, we can have 100 sites. And we have like 30 sites now, and it works very well. And we leave about 15 minutes for questions. And that 15 minutes, it isn't enough for everybody, but it does generate a lot of discussion. Time zones is a big problem. We're in Canada, so we can go to Europe, Middle East, Africa. India was a problem time zone because of the 12 hours. You almost need to have hubs. You need to have, we organize this in our time zone, and it's good for a certain number of time zones. You need people to take the initiative in other time zones and to do this. And I think doing it live is better than simply recording and looking at it, because when you do it live, you can get the two-way interaction. The other way, you don't.
Thank you once again.